I want to ask about something that President-elect Biden said this week. He said the darkest days in the battle against COVID are ahead of us. Dr. Fauci, as you know, over 100,000 of our fellow Americans spent their holiday hospitalized with COVID-19, and we're averaging nearly 200,000 new cases, more than 2,000 deaths each day. Do you agree that the worst is still yet to come?
You know, I do, Dan, and the reason I'm concerned, and my colleagues in public health are concerned also, is that we very well might see a post-seasonal, in the sense of Christmas, New Year's surge. And as I've described it, as a surge upon a surge, because if you look at the slope, the incline of cases that we've experienced as we've gone into the late fall and soon to be early winter, it is really quite troubling. You mentioned the numbers yourself quite correctly when you're dealing with a baseline of 200,000 cases, new cases a day, and about 2,000 deaths per day. With the hospitalizations are over 120,000, we're really at a very critical point. If you put more pressure on the system by what might be a post-seasonal surge because of the traveling and the likely congregating of people for, you know, the good, warm purposes of being together for the holidays, it's very tough for people to not do that. And yet, even though we advise not to, it's going to happen. So I share the concern of President-elect Biden that as we get into the next few weeks, it might actually get worse.
Well, I want to ask you about travel. According to AAA, as many as 85 million Americans were expected to travel over this holiday. More than 1.1 million people were screened at airports yesterday. So what should we expect in terms of a post-Christmas COVID surge when you look at those numbers?
Well, again, there's no guarantee it'll happen, but there certainly is a danger of that. When you travel, you see pictures on the TV screens, Dana, of people at airports crowded in lines, trying to stay physically separated, but it's so difficult to do that. And that generally is followed when people get to the destination they want to be, that you're going to have mixing of household people at a dinner or at a social function. Those are things that naturally happen, and as much as we advise against it, nonetheless it happens. And that's one of the reasons why we're concerned about that being a real risk situation for the spread of infection.
Let's talk about some of the solutions in terms of coronavirus. You acknowledged to the New York Times that you've moved the goalposts in terms of what it would take to reach so-called herd immunity in the United States. Here's what you said. You said, when polls said only about half of all Americans would take a vaccine, I was saying herd immunity would take 70 to 75%. Then when newer surveys said 60% or more would take it, I thought I can nudge this up a bit. So I went to 80, 85. And then you go on to say that it may be as high as 90%. So my question is, why weren't you straight with the American people about this to begin with?
No, actually, Dana, I don't think it can be interpreted as being straight or not. We have to realize that we have to be humble and realize what we don't know. These are pure estimates, and the calculations that I made, 70, 75%, it's a range. The range is going to be somewhere between 70 and 85%. The reason I first started saying 70, 75, I brought it up to 85. That's not a big leap to go from 75 to 85. It was really based on calculations and pure extrapolations from measles. Measles is about 98% effective vaccine. The COVID-19 vaccine is about 94, 95%. When you get below 90% of the population vaccinated with measles, you start seeing a breakthrough against the herd immunity. People starting to get infected like we saw in the upper New York State and in New York City with the Orthodox Jewish group when we had measles outbreak. So I made a calculation that COVID-19, SARS-CoV-2, is not as nearly as transmissible as measles. Measles is the most transmissible infection you can imagine. So I would imagine that you would need something a little bit less than the 90%. That's where I got to the 85. But I think we all have to be honest and humble. Nobody really knows for sure. but I think 70 to 85% for herd immunity for COVID-19 is a reasonable estimate. And in fact, most of my epidemiology colleagues agree with me.
Yeah, of course, nothing is exact. I guess my question was about polling. It seemed in that quote to suggest that you were basing your recommendation on polling and what people could accept. Is that not what you meant?
No, I mean, it's a bit of that. I want to encourage the people of the United States and globally to get vaccinated, because as many as we possibly get vaccinated will get closer to herd immunity. So the bottom line is, it's a guesstimate. I gave a range, and I use any discussion like we're having now, Dana, to encourage people to get to that goal of 70 to 85% of the people vaccinated. That's where we really want to be.
Okay, and just to put a button on it, no sugarcoating, you're saying 75 to 80% is the goal in your view as of now, based on what you know when it comes to herd immunity, not 90%.
Right.
Okay. Thank you. So one more question. When does that need to happen in your view?
Well, if you look at the logistics of it, Dana, right now we're going through the priority groups. We started with health, frontline health people who are on the front line taking care of patients. And then you get to people who are in a difficult situation, namely people who have underlying conditions, essential people in society. And then you go down the line. Once you get there, what I call open season, namely when anybody who's anybody, you don't have to be a priority person, should get vaccinated. I think we're going to get there probably end of March, beginning of April. So if we start vaccinating the general population in April, from a pure logistics standpoint, it's probably going to take several months to get those people vaccinated that would get us to the 70 to 85% group. I think that's going to probably be by the middle to the end of the summer, so that I hope that by the time we get to the fall, we will reach that critical percentage of people that we can really start thinking about a return to some form of normality.
I want to ask about what's going on in the UK and South Africa, where health officials say that new coronavirus variants there appear to be more transmissible than the current strain, and that the UK strain may be potentially worse for children. You said you're assuming that these variants of the virus are already here in the US. How worried should Americans be?
Well, I mean, obviously, this is something we always take seriously and are concerning whenever you get a mutation. But I think the American public needs to remember and realize that these are RNA viruses, and they are continually mutating all the time. Most of the time, the mutations don't have a functional significance. But every once in a while, when you track it, you see something that gives a hint of, or maybe even a reality of, a higher degree of transmissibility. The UK, our British colleagues, have looked at it. We're looking at it intensively now. Does it make someone more ill? Is it more serious virus in the sense of virulence? And the answer is, it doesn't appear to be that way. The other issue is that, does it escape the protection that's induced by the vaccines that we're currently using? And according to our British colleagues, that does not seem to be the case. Having said that, you take something like this very seriously, you follow it very carefully, and you make whatever adjustments you need to do based on the data as it evolves.
So you feel confident in what you just said, that the UK officials are saying that so far it appears that the vaccines that we have are strong enough to deal with this new variant?
That's what they are telling us, but we're going to be doing the studies ourselves. We're getting isolates of it, making combination of viruses to be able to directly test, getting sera from people who we have vaccinated, and see if it still neutralizes this new strain, this mutant strain that's coming from the UK, as well as from South Africa. There's a similar, but not entirely the same type of mutation that we're seeing in South Africa.
Dr. Fauci, the U.S. will now require travelers from the U.K. to test negative before arriving in the U.S., but that policy doesn't go into effect until tomorrow, and we've known about this new virus variant in the U.K. for a couple of weeks. Was it a mistake not to implement this rule before the Christmas travel boom?
You know, Dana, I'm not going to say it was a mistake or not. Obviously, I think the move to put some form of restriction on travel and restriction could either be blocking out travel completely, which the decision was made not to do that, but I think it's prudent and a good idea to do some form of testing and not let somebody on the plane from the UK unless they have a documented negative COVID-19 test. So I agree with that. I mean, you could argue about the timing, whether it should have been done a few days before.